Presented with palpitation, and I'm presenting the case of sinus tachycardia, and I will be explaining you first in English and then in Hindi. So, in very brief, I will explain you the ECG, how to identify patient presentation, causes, and the treatment. So please watch till last, from beginning to last, for full understanding. So a young lady, female patient, 23-year female patient, presented with complaint of palpitation, abdominal pain, shortness of breath. So abdominal pain was because of the mild splenomegaly, and shortness of breath and breathing difficulties because of palpitation. And what is palpitation? Palpitation is increased feeling of increased heart rate. सो पेशेंट को इंक्रीज हार्ट रेट या धड़कन बढ़ी हुई फील होती है, दैट इज़ कॉल्ड पाल्पिटेशन. एंड व्हेन वी गॉट ईसीजी डन, देन द हार्ट रेट वाज अराउंड 150. हाउ आई कैलकुलेटेड द हार्ट रेट, आई विल एक्सप्लेन यू दिस. वी हैव टू count number of boxes, large boxes 1 and 2, between two R waves, one R wave, second R wave. So we have to count the number of large boxes, one large box and the second large box. Then we will divide it in by 300 divided by 2, so is equal to 150. So this is the heart rate calculation, means number of large boxes 300 divided by number of large boxes. So as you can see, there is 1 and 2 large box, and 300 divided by 2, this gives the heart rate. Now I will explain you why this is sinus tachycardia. In sinus tachycardia, there is sinus rhythm and heart rate is more than 100, which is more than normal. So every P is followed by QRS, then T. Every P is followed by QRS, then T. So here P, QRS, T, P, QRS, T in first lead. Then second lead is rhythm lead. There also P is followed by QRS, P is followed by QRS, and constantly heart rate is increased. As you can see, around 2 or around 2, more than 2 heart large boxes difference is there between two R waves. Now I will show you in lead, in this lead V4, V5, V6 also. Number of large boxes is 2, 300 divided by 2, that becomes heart rate of 150. And every P followed by QRS. In PSVT, the P wave you cannot see. If it is PSVT, you cannot see the P wave, but in sinus tachycardia you can see P wave, then QRS, then T, then P, QRS, T. That is very clearly visible. So this is sinus tachycardia. You can see ये साइनस टैकीकार्डिया का पेशेंट है, जो कि प्रेजेंट हुआ था हृदय की बढ़ी हुई धड़कन के साथ में, जिसको कि पाल्पिटेशन कहते हैं. और इस पेशेंट को एब्डोमिनल पेन भी था स्प्लीनोमेगैली के कारण, विच इज़ ड्यू टू अनदर रीज़न. तो इस पेशेंट में हमने हार्ट रेट कैलकुलेट की. ये हार्ट रेट हम ऐसे कैलकुलेट करते हैं कि 2 R वेव के बीच का इंटरवल देखते हैं, लार्ज बॉक्स. तो 2 R वेव के बीच में 2 लार्ज बॉक्स है, तो हम इसको 300 से डिवाइड करते हैं, तो 150 इसकी हार्ट रेट आ गई, लाइक दिस. 300 divided by 2, 1 large box, 2 large box. Now comes the causes. Causes may be non-pharmacological or pharmacological. So few causes I will mention here, like exercise, pain, anxiety, and hypovolemia, and sepsis and fever, pyrexia. And other pharmacological causes include beta agonist, noradrenaline, isoprenaline, salbutamol, and dobutamine. These are drugs which cause increased heart rate. And what is sinus tachycardia? Sinus rhythm, then means every P is followed by QRS and heart rate is more than 100. This is sinus tachycardia. And for treatment, we can give antiarrhythmic drugs. From antiarrhythmic classification, we can give amiodarone. So in amiodarone, the dose will be, we have to give like 1000 milligram over 24 hours. So 150 mg initial dose, loading dose is 150 mg in D5W 100 ml over 10 minutes. So this is the dose of imidron. Then we also can give verapamil, and this is the dose 150 mg in D5W 100 ml and over 10 minutes. So imidron we can give calcium channel blocker like verapamil, and we can give this diltiazem. The dose of diltiazem will be 0.25 mg per kg body weight. Okay, so these are few important things in treatment. So I told you the treatment, I told you the causes, pharmacological and non-pharmacological causes, and I told you how you will identify. And this is the ECG of sinus tachycardia. You can take a screenshot how it looks like this. So this was a brief video about the sinus tachycardia, how the patient presented, and heart rate was 150. And for management, we give the Medron. We can also give the diltiazem and other antiarrhythmic agents also, since Medron is the most commonly used in variety of arrhythmia. So we will monitor heart rate on a regular interval, and this is the loading dose. Then after admission we will give the rest of the dose of the around 850 to 900 mg in rest of the 23 hours. So please guys follow me, and on Instagram the ID is DRANUJ5, and Facebook the link of my social accounts and social connection given on the bio section in my about section. And please like, share and subscribe. Thank you for watching.